going forward, there's some real changes coming to Medicaid in Louisiana. First, as I'm sure everybody's heard of, is this new Bayou Health Managed Care initiative that started taking place in February and will be statewide by June. Under this, about 2/3 of the Medicaid enrollees, 900,000 people, are going to now receive their care through 5 managed care insurance companies who will be paid by the state to manage their health care. This represents some promise, but also gives some challenges. On one hand, the hope is that these managed care companies, through reducing unnecessary hospital stays, can save a lot of money. On the other hand, you have to work administrative costs and profits into this, and still hope to achieve those savings. So your kind of room to achieve savings kind of goes down. And then when we run into a budget shortfall and you start cutting the provider rates more, you kind of run out of more room there. So we don't really know how this is going to play out. As I said, it doesn't really go statewide until June 1st, and so I think a lot of people are really keeping an eye on that and making sure that that folks are still receiving the services they need. Again, most of the people on this program are children, so kind of the most vulnerable folks who we really want to look out for and make sure they get the preventive services that they need to grow up and be healthy and be productive members of society. So I think there's going to be a lot of people looking at Bayou Health and seeing, does it increase health outcomes? Are people healthier? And are we saving money in the right way? Because we don't want to save money by keeping people from going to the doctor. We want to save money because people are healthy and don't have to go to the doctor. But that's a big open question right now, and there's concern that if we keep on cutting money out of the program, that we may achieve those savings in the wrong way. There's also another big thing you may have heard. I know it's not at all been a huge political controversy. This Affordable Care Act, OBAMACARE, healthcare reform, is coming. And the case was up before the Supreme Court in March, and it was a pretty big deal, and we're supposed to get a ruling by June. I think it's going to be upheld, personally, and I think that's a good thing for Louisiana, because if you look at the numbers, and if you really look under the hood of healthcare reform, Louisiana is one of the states that stands to benefit the greatest. Again, we have a very low-income population and a high rate of uninsured, and one of the hallmarks of the Affordable Care Act is it's really going to expand health insurance in 2 ways. One, it's going to increase Medicaid eligibility up to 133% of the federal poverty line. Right now, if you're an adult with children, you have to make 15% of the poverty line or below to qualify. That's $3,500 a year. We're talking very, very low income. If you're a child, you can qualify up to, if your family makes up to 200% of the federal poverty line. So you have a lot of people who maybe their kids have health insurance, but the parents don't. And under the Affordable Care Act, that's going to change. They're going to have access to Medicaid. Also currently under Medicaid eligibility, someone like me, a childless adult, doesn't matter if I have 0 income. I don't qualify for Medicaid. Under the Affordable Care Act, that'll change. If I make up to 133% of the poverty line, about $15,000 for an individual, about $30,000 for a family of 4, you can qualify for Medicaid. It's going to be a tremendous expansion of access. We've looked at some of the numbers, and we think that the rate of uninsured Louisianians will drop by more than half. So you can talk about 500,000 people will gain some coverage either through Medicaid or through another component of healthcare reform, the health insurance exchange. The health insurance exchange will be a new entity that's set up, kind of the Expedia of health insurance, if you will. It's more complicated than that, but they're going to set up a website where if you don't get insurance through your employer, you can shop for insurance, and if you make up to 4 times the poverty line, you can qualify for tax credits to make that insurance affordable. The exchange will also be a boon for small business. They'll be able to pool their purchasing power the same way that large employers do, and it should really reduce costs for small businesses as well. And this is private insurance, so when you hear people say that Obamacare is a government takeover, that's not true. The exchange will really help people access the same insurance options that are out there today, but it'll be higher quality and it'll be more affordable. So it really offers a lot of promise. Unfortunately, the current administration has decided they don't want to set up an exchange, and so they're deferring to the federal government to set up an exchange for them. And we really don't know a lot of the details about that yet. But that's another thing that will really be kind of a big deal over the next 2 years. Because unfortunately, the Affordable Care Act does not go into full implementation until 2014. So right now, we're still kind of waiting. We're looking at the Supreme Court. We're trying to keep the system running as it is. There's a lot of hope that Bayou Health will help, but also if we keep cutting rates, it could hurt. So we don't really know.